Good afternoon, everyone. Uh, Good afternoon. I'm going to get us started. We have a busy schedule tonight. So, participating by video conference, I don't know if we have anybody on video today. Maybe everybody's. There's an echo. What is that? Anybody know?
Maybe someone has it.
Okay. So, now, what we've been transitioning to, as everyone might remember, is we've been transitioning to holding public communication for all of our committees at 5:30. But this is a new process for us. So what we're going to do today is, because we have someone that we really want to hear from, as well as anyone that's here right now, we're going to call Walter Moreau up so he can make his comment now because he needs to leave before 5:30. So Walter, we welcome you and appreciate all the work you've done for us in this community. Yes. Well, Walter is special.
Great. Well, thank you for accommodating me at 4 o'clock.
Sure.
I'm Walter Moreau, the Director at Foundation Communities. We provide affordable housing for about 9,000 residents here in Austin, about 1,000 who are formerly homeless. We also do a lot of social services, and I wanted to speak to two different elements on the health-related services that first is, you may be aware, we do health insurance enrollment in the marketplace and other coverage. We have a federal navigator grant that helps us enroll about 5,000 folks a year. Starting in January, we started getting the names of folks in the community that were dropped or disenrolled from Medicaid and CHIP.
Okay.
And because we have this federal navigator grant, we are the only licensed, certified, approved entity to get this personal identification information. And it started out in January with a few hundred names, and then it was 1,000 names, and then it was 5,000 names, and then 17,000 names.
Oh, wow.
As of last week, it's 67,000 names, which is an overwhelming number of folks in Central Texas that have been dropped from Medicaid and CHIP. And this has just happened in the last 60 days, and I wanted to let you all be on alert for this.
Mm-hmm.
Oftentimes, folks don't know they've been dropped until they show up in the clinic and they find out they don't have coverage. So we have scrambled around. We've got 15 volunteers now in a boiler room calling through the list. We've served about 20% of the list so far. We've re-enrolled about 1,000 people in the marketplace. The deadline is the end of the year. Mm-hmm. They've extended the special enrollment for the marketplace as well as then open enrollment starts. I don't know if you can help us because we get because of the connection with Sendero, CMS has said we can't receive any help from Central Health. We used to invest in this enrollment work, which was huge for 12 years, but that we had to stop that. But I at least wanted this board and the Central Health staff team to be aware that this is sort of a quiet crisis that's happening with the end of the COVID extensions for Medicaid and CHIP. And we're trying to do the best we can to reach people. The second thing I wanted to just share is that we have been working with staff around, for the 1,000 residents that have been homeless in our supportive housing, the health needs are very, very high and overwhelming us. We are really struggling with psychiatric needs and just physical health issues. We have case managers on site. We have a mighty staff nurse team of 3 that circulate between the 8 communities. But we aren't a psychiatric agency. We're not a health agency. And so I'm really, we're enthusiastic and hopeful about the bridge teams that the staff are creating. Mm-hmm. Maybe by the end of the summer, being able to help pilot at our Waterloo Terrace community. it couldn't come quick enough. So we're looking forward to a partnership on that front. We want to keep our residents housed that have been homeless now that they've got stable housing, but if the health needs are beyond what we can provide as a supportive housing landlord, we're in trouble. So that's happening. Thank you.
All right, thank you, Walter. And maybe Dr. Lee, someone can follow up with him. I don't know if there's anything we can do to help Walter, but we can talk with you. Thank you for working on those 67,000 people that were kicked off of Medicaid. So
Yeah.
thank you for
Yes.
doing that.
Absolutely. I think our eligibility team is coming up alongside to work a similar problem. I'd love for them to connect with you and learn about what you're seeing.
We haven't had a chance to meet yet, but
Yeah, it's great to meet you.
Welcome. Thanks.
Thank you.
Thank you, Walter. Okay, everyone, our first item of business for the committee, and let me just say that, Dr. Brinson, I believe, is traveling, which is why I'm chairing the meeting today. So, first item of business is to review and approve the minutes of the May 8th Strategic Planning Committee meeting. So I have a motion from you. Second? Second. Okay. All in favor?
Aye.
Minutes pass. Okay, second item is receive an update on Central Health's communications, engagement, and outreach efforts, including the Unified Branding Initiative for the Central Health System. I think Ted Burton is presenting with his team.
Hi, everybody. I am Ted Burton, Chief Communications Officer, with my colleagues.
Diana Berno, Creative Services Manager.
And Ivan Davila, Senior Director of Marketing and Communications.
So today, when you walked in the room, I hope that something looked different, other than the fact that Trilisha and I were wearing matching outfits. You might want to look behind you.
And there's a cake.
So today, we're going to be celebrating Central Health's 20th anniversary, but it's also a new era, and we are unveiling a new identity for the Central Health System, including our partners, Community Care and Sendero. I want to quickly look back. We've done this many times over the last few years before we look to the future. Next slide. You'll remember back in 2017, Travis County Commissioners Court recommended a performance review of Central Health. One of the key findings was, and you're familiar with this, there is confusion among constituents regarding the relationship between Central Health and its various enterprise partners and affiliated partners. So our aim for the last 5 years actually has been to build a brand family that clearly communicates who we are, what we do together, and whom we serve. So the work began back in 2019, and then you'll remember, we can go to the next slide, there was a pandemic, and we had a pause to focus on many other things other than branding during that pandemic. But back in 2021 and 2021, we presented some concepts to you. We paused and came back in 2023 and jump-started the research effort. So as we presented to you many times, we conducted peer research, we conducted quantitative online surveys, in-depth interviews with Community Care, Sendero, Central Health stakeholders. Many of you were interviewed. We conducted focus groups with patients, non-patients, staff, and then we did interviews with our patients who speak languages other than English. We heard pretty loud and clear from patients that they wanted a healthcare system that is easy to navigate, reliable, and staff told us they wanted a unified brand concept that we could all stand together as one. I remember in one of the focus groups, one patient, it was a woman, and she was a patient, told us that she would have felt more confident if she'd known that Community Care and Central Health were connected, and her comments have stuck with Yvonne and I. And so, this is where we are and what we're doing now. I want to direct your attention to a quick video so everybody catch a screen in the room. And we're going to play a quick video. I'm going to turn it over to my colleague, Diana, to present more on this branding initiative. We're switching from a PowerPoint to a video, so. Imagine that with really dramatic music. I would try to sing for you, but you might throw something at me, so. I'm not sure which would be worse. We can try that after the meeting.
Well, it is my delight to present to us in the room and everyone online our new brand mark. It is a really exciting day for us. And from the video, you can see that the C from Central, as well as community and connection, are pretty evident in our mark, as well as the H, meaning health, and also hospital in Travis County Hospital District. Also with us is the healthcare cross. It's a universally recognized symbol for healthcare. It's also for us a plus sign, and it signifies growth and connection, and I'll go into the ways that makes itself known. You can see here how the brand mark serves as an anchor for our entire design system and for all of us within the Central Health System. And you can also see here how we have gotten to this space. So from our research, you can see how people might have been confused by our connection, and we hope that with this new branding, you can see that we are one unified front as we move forward. Here is how we will show up together, whether online or in person. You can see we'll have different ways that this presents itself, but this is at its core our brand mark and all of our entities in one space together. Our new logo also serves as an anchor for branding our programs and initiatives and locations as well. So this system aims to keep our initiatives on brand, especially as new ones come on board. We have a program that solves for that. But a brand is more than just a pretty face, it's also a pretty typeface. This is our new corporate typeface. Its name is Walter. It's a unique and distinctive, approachable and accessible typeface. It's very legible, and it perfectly reflects our brand's identity and our values in all of our communications.
And we own that typeface, so it's ours.
We do, we do. With our new brand assets, you'll also see more patterns come on board. So this is where you'll see our healthcare cross getting elevated, leveraged as a texture, as well as the plus sign and brackets and pattern coming to life. Here's where you can see that connection and growth come to play in our design system. Our logo itself features this dyad of forest teal and lighter teal. So we have a scientific study that shows us and tells us that color tells us that these hues alone invoke feelings of trust and healing, which we also heard from our consumers during our focus groups. But this dyad, along with our warm neutrals, it comprises our core palette. Along with that, and to strengthen the unity and build on Community Care's market recognition, we incorporated their legacy orange, imbuing that warmth across all of our communications, and also reinforcing a whole system-wide commitment to patient-centered care. Furthermore, we added
I was just going to remind you
accent
that
colors.
this is not the actual color as it comes across on your phone or your computer. On a big screen, it looks a little bit different. So check out the website. It's been reskinned, and you'll see the true colors.
Oh, yeah, for sure. Is that the true color? It is the true color, yes. In person, in life, but on the screen, sometimes it will shift a little bit. We also have these design assets, along with some pictograms that are stylized. The brackets like this are derived from the healthcare cross. We can use these assets to frame and draw attention to specific content with within all of our marketing materials. The way you'll see our brand brought to life is within the website, like you mentioned, Ted. That came on board earlier this week. We also have, you see here, our current site. We also have our PowerPoint presentation that we're viewing now. We have a sample of what this might look like on our YouTube channel, so we'll start to see these assets come in with all of our new content from this point forward. We are also live on social, so if you go over to any of our social channels right now, you'll see the new brand active, as well as an announcement and some of our new colors at play. We've been able to push this out to date. This is a sample of other ways that our social assets and our communications will come to life. You can see the system coming to work here, as well as other ways that will come into play. Include information design like this, so we'll lean into an accent color like lime to maybe draw some impact or draw some attention to impact numbers, pictograms. We foresee community care picking up the orange in the same way, so we're at our foundation using our core palette, our core system, but then allowing us some differentiation between communications and locations. And then this is how we foresee, this is an actual render of our sign for Rosewood Zaragoza. So this will come on board in the summer or later this summer. And I'll let Yvonne speak to how we come to life after this.
Sure. Thank you, Diana. So you'll see here this really beautiful timeline that Diana also helped design. So before this year, the performance review really confirmed the brand dissonance that we've been experiencing as a system in the last 2 decades. But this year we've made a lot of progress. Ted already shed some light on what happened before this year as well. But just to give you a little bit more insight as to what we've been doing in the last several months. The official reveal of the new brand really took place at the March all-staff meeting with Central Health staff, where we provided staff with a sneak peek of the brand and distributed branded jackets to further reinforce the new identity. And then in April, our team delved into further refining the brand, including finalizing the brand strategy and the messaging and some design elements to ensure consistency and coherence. We began developing some priority touch points, ensuring that we were focusing on key areas of impact. And then we also finalized a comprehensive rollout plan, which is what we've been implementing since last week and today, which included outlining the timeline and the strategies for implementation. Last week, we rolled out we announced the new brand to the entire system across all staff. Across the system. And then this week, we've been focusing on communicating the brand on social media and then to media outlets, etc. So really, May has been a busy month for us as we announced the launch of the new brand to our patient population. So we also made sure that we sent communications to our patient population so that they weren't confused when they suddenly saw a different look and feel. Also with media outlets and, as I mentioned, staff members. And we started the implementation of the brand across digital platforms, like my colleagues mentioned, including the website and social media channels. And finally, all the design assets are being completed so that they can be ready for deployment. These include our brand guidelines and new logos, making them available to all employees. Typeface implementation. Who would have thought that implementing a new typeface would be very challenging? But we're actually finalizing the implementation of the typeface. The new email signature will be implemented as well across the system, and also deploying our new presentation template. Right. So with all these new tools that we've been developing, comes also training employees on how to use these tools as well. So. On that note, Diana and our creative team of Diana will be made, and also Camilla, so that we have a team of 2 people who will be made available to staff during office hours to minimize confusion and to ensure the seamless adoption of the new brand identity. And then in June, the work continues. We'll be working on our priority touch points, arming our staff with all of these resources that I mentioned so that they can become brand ambassadors. Some of these include updating employee badges. So these badges right here and these reels right here so that they're updated with a new brand. Also scrubs, polos, uniforms, making sure that we have a consistent look across the system. And the business suite, which includes business cards, letterhead templates, memos, etc. And then over the course of the next few years, we will roll out the new brand across the entire Central Health system, internally and externally. This is going to take time, and we're going to be phasing this out to ensure that we are being mindful of taxpayer resources. So we're going to be extending this over the course of the next few years. So this includes updating building signage to reflect the new brand identity, particularly those with direct patient interaction. We will be prioritizing buildings with the highest visibility. So it's, again, starting with patient-facing facilities. We do have a work request process for employees. Employees can submit requests for branded items through an online form that's integrated with our project management platform so that we can streamline the implementation process.
Thanks, Javon. So just to wrap up, I want to provide a few thank yous. So first of all, thank you to Community Care. Tara and Jason are here. This would have been impossible without their strategic partnership, and I really appreciate them being along with us every step of the way. Jason, since the very beginning, back in 19 or when it first began. Same with Sendero. Sharon has been very involved, and Rudy and Karen, and so again, we appreciate their collaboration. I want to thank our agency, Belmont Ice House. They've been with Central Health longer than I have, and I've been here 8 years, and so I really appreciate their hard work. And then our staff. If I start naming people, I'm going to miss somebody, but the communications team, the dream team, they don't take my calls anymore, so I'll go through you if I want to reach them, but they've been amazing. Diana joined us just a few months ago, the same time Pat did, and I can't imagine having done this without Diana, Yvonne, Camilla's in the audience, and then the old guard. So Mike McKenna, Anastasia, there's a lot of folks behind the scenes, Mike Clark Madison, that made this happen. So I really want to just give them a shout out, and if you see them, pat them on the back, and again, tell them to unblock me so I can call them.
Thank you.
Well, on behalf of all of us, I just want to say thank you to your whole team, as well as to our partners with Community Care and with Sendero. This is a wonderful effort. It was just, some of us were able to go to the community conversation that we had the other night, and one of the things that was evident for the folks that we were talking to is some of them didn't quite understand how everybody works together. So I think this branding effort is really going to help all of us as we talk to the community and help the community understand how we're all one team. We're really working together. So thank y'all for this.
Thank you.
So, well,
Thank you. Thank you so much to the Dream Team. I remember, oh my God, back in the days when we were talking about this branding in that small room,
Yes. A
pre-COVID.
week before we closed down we shut the office for COVID.
So it was pre-COVID, so this has been a long time in the making, and I appreciate you all taking the time to listen to the board members' feedback, to community and everyone else, and doing this as a collaborative approach. And thank you. I really appreciate it, and I hope this brings forth additional transparency, and folks can understand who we are and how we interact with the full enterprise. And I commend you on all your efforts. Thank you, and I am waiting for my new business card.
all right. Well, thank you
you.
all. Okay,
I did.
go ahead.
I did have a sort of question / comment, and that is about, I think that, and maybe this is occurring already, but I think anytime our patients are in direct contact with our staff, I think, for example, in the hospital, scrubs frequently delineate what specialty you're with, and I think if our people wore the same color scrubs beyond just the little name tag saying Central Health, it'd make a really a big difference, because I think then it becomes evident about our contact all the time with the medical teams that are around patients, et cetera. And I think in the clinics, I think it'd be a lot of continuity there, so
You and Dr. Schlosser are on the same
there we go.
line.
Yeah. And actually,
Right.
that's part of where we are working with our teams across the board. So we will be seeing an uplift in our uniforms as well, and alignment on our colors, so that there isn't confusion about what role everyone is playing when they are interacting with our patient
Great.
population.
Well, thank you all for the very good work. I appreciate it.
Thank you.
Manager Jones?
Yeah, I'd like to thank you all. Fantastic, absolutely. Is it possible you could go back to the logo where the transitioning was?
The video?
The video?
Video was.
Sure. Cynthia, you gonna sing the music?
Why don't you both do it?
No, actually,
We'll play it real quick for you.
I didn't hear any music.
Well,
No, there's no-
there isn't right now.
Okay, well, I have a suggestion for music, that's why I was,
Oh,
Uh-oh. Beyonce? That's what I was thinking.
for those of you who are baby boomers, you might recognize this. Hopefully it'll come out. Oh, no, it's not gonna act right. Okay. 4, 3, 2, 1. No, it's not coming.
Press that skip.
Okay. Okay. I hope this is the right one.
Oh, yes.
No, it's Space Odyssey.
Space Odyssey, but I don't know the year, 2000.
It's under 2000.
Okay,
Oh,
all right, moving right along. So, thank you, thank you, Manager Jones. I was actually thinking of that one. Let's see. Did you want to say something? Manager Motwani and then Manager Valadez.
So I'm asking a question, but I don't expect it to be answered today, especially in the interest of time, but hopefully it can just be in sort of the collective thought process as y'all continue to share updates with us. But yesterday in the community conversation, as Chair Kitchen was mentioning, I also heard from a number of folks, but one in particular, about just sometimes how it can be challenging when one is referred from their primary care provider to a specialty care provider, and trying to kind of keep track of all the names of the different brands. And I noticed that in your timeline, it said like June or July was like when when some key patient-facing elements were going to be converted to new brand. And then, of course, in the 2 to 3 year period, I'm assuming that might make its way to patient-facing elements like portal and charting and things like that.
That'll be sooner than, yeah.
Sooner.
Yes.
And I think there are also likely contracted providers who are not enterprise branded, but be great to hear about what the patient-centered experiences may be like when it comes to sort of harmonizing the brand, their facing brand depiction when it comes to sort of following their medical records. And not now by any means, but I will say it was a great luxury to be able to point to this new brand that you all had just unveiled yesterday to show that this organization is very focused on a patient-centered design and presenting a harmonized view such that the patient would be able to navigate more clearly. So thank you all so much.
Thank you.
Thank you. Manager Valadez?
Mine's very quick, and it has really nothing to do with the use of the term of teal, which all I can think of in my head is that teal, the color of gangrene, if anybody ever saw that movie. But that's, aside from that, I noticed that it says Travis County Hospital District. And I thought for some reason or other, and maybe I'm totally confused, I thought we were the Travis County Healthcare District.
That is a transition that we've made, and I'll
It's what
speak to it.
we've been using hospital district. Is Monica can give you the legal, is she in there?
Well, no, the only reason I'm asking is because I've always known it to be healthcare district. And I didn't remember when we were having a transition from healthcare district to hospital district, or if we had a conversation about it on the board.
I'm not
Because
sure.
that's a different focus to
Yeah.
me. It takes me hospital, and it's like, I think of hospital. When you think of healthcare, it's, to me, a bit more encompassing.
I think
So
that
that's, I would have liked to have been a part of that conversation.
well, I've heard Monica Crowley say that we've always been a hospital district. That is the
That's
That's
the
the
legal
legal term.
The legal
Right.
term.
If that's the
and in
legal
writing.
term, then
So
then
that-
we
yeah,
need to use
that
the
is-
legal
That is the
Right.
legal term,
I
I
agree.
believe.
That's right.
I agree.
I wasn't here, I think in the beginning, it was referred to as a healthcare district, but legally we're a hospital district, and we've been
Right.
using hospital district for many years now, from a communication standpoint.
Okay, now, I know when I came on in 2015, and Trish Young Brown was our CEO, it was always the Travis County Healthcare District.
Yeah, I remember what you were saying, Manager Valadez.
And
'cause
so
it-
I just
Yeah.
wanted to get it clarified. But I also firmly believe that we should be using the correct terms.
Yeah,
Thank you.
okay.
Thank you.
Thank you.
Thank you all. Thank you very much.
Thank you.
Okay, so there's no motion needed on this item. So we'll move on to item number 3, which is confirm the next strategic planning committee meeting date, time, and location. So managers, our next Central Health Strategic Planning Committee meeting is tentatively scheduled on Wednesday, June 12th at 4 PM at our Central Health Administrative Offices right here, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment from Manager Martin with a second from Manager Motwani. All in favor? Aye.
Aye.
Okay, so we're going to, we're now going to move on to our next committee meeting, which is our Budget and Finance. So I'll hand it over to Dr. Nusai.
Okay, Good afternoon, everyone. Today is May 22nd. Sorry, the script did not say the date. May 22nd, 2024, and it is 4:31 PM. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Do we have anyone? Is Dr. Brinson now? Okay, thank you. So I would also like to announce that in order to make it more accessible to community members, we will hold public communication for the Strategic Planning Committee, Budget and Finance Committee, Executive Committee, and the Board of Managers meetings at a time certain at 5:30 p.m. If anyone from our community would like to speak before us, before our 5:30 time certain, before Budget and Finance, please let us know prior. We will accommodate you as well. And I just also want to make sure that for today's agenda, we will be moving the agenda slightly different and out of order because we have a closed session. So item 2 will be taken up last before we adjourn. Now, before we start, I want to, first of all, I have a main announcement. On Saturday, May 18th, 2024, I officially graduated from the UT School of Public Health, and I walked, and I appreciate all the love and support that I've received from my Central Health family, from everyone out of this room. Thank you for making that day possible. It was a day full of mixed emotions, so I appreciate you all. And here's the program if anyone is interested about my commencement. And I also brought some sweets from Palestine to share with you all. So I just, again, I want to acknowledge you all and thank you for your support throughout the years. And the reason why I pursued public health is to primarily serve humanity and save lives. And for that, we can proceed. Thank you.
Thank you.
Thank you. Now, agenda item number 1. Approve the minutes of the April 24th, 2024 Budget and Finance Committee meeting. I move that the committee approve the minutes of the April 24th, 2024 Budget and Finance Committee. Do I have a second? Manager Valadez?
First, I'd
second.
like to make a correction.
Yes, please.
On the minutes, it says that that Manager Valadez was absent. I was actually on video and could not call in. I could not be seen, but I was actually sending in through chat my comments as y'all went through agenda items.
My apologies.
No, and I think that Vedla called me afterwards and said that they had seen that I had been sending something in through chat, and she didn't know how that was possible because chat had allegedly been disconnected, but yet my messages got through. So I just wanted to make sure that corrected. I was present, and at least via an unknown site.
Thank you. Legal,
Yeah, sorry,
David?
we researched that, and there are 2 forums where the meetings are broadcast. One is YouTube, one is the Zoom link that is at the top of each agenda, long bunch of digits and stuff. If you're on the Zoom link, you can be present because it meets the requirements of the Open Meetings Act. YouTube does not, because it's not interactive. You can't be seen, which is why we couldn't see you, and the reason chat was on is you were chatting in YouTube. So if you use the Zoom link, we can count you present. We can't count you present on the Zoom, on the YouTube. It's just not, it's not legal.
Perhaps, David, may I?
yes, please.
David, perhaps we can just acknowledge in what we write into the minutes. We can just add some language that meets with the requirements that you're citing to acknowledge that Manager Valadez was trying to participate, so
we
we
can
can
do
get
that.
that language.
Yeah.
Okay, yeah,
And if I'd like for you to please send me a copy of that, or forward to me a copy of that citation, where it is in the law. Because I even called and left messages, I spoke to the receptionist up front, to
Okay.
please get a message to Brianna, let them know that I'm trying to get in. I tried 3 times to get in, and for some reason or another, it didn't happen.
Thank you, Manager
So I just wanted
Villegas.
to make sure that
We
it
will
wasn't without
forward
me
that.
trying to get in. Thank
Yes,
you.
we're gonna write that in.
I want it there. Thank you.
Okay.
Okay, and we'll send you the language.
Mm-hmm.
So who would like to second my motion?
Yeah, I second it with what we just discussed, which was to add
Okay.
language that explains Manager Valadez's
So
participation.
any further discussion? I see none. All in favor?
Aye.
Any abstentions? Anyone oppose? I see none. Motion passes. Thank you. Agenda item number 3, receive and discuss the quarterly financial and operational report for community care health centers. Jason Fournier and Tara Trower will be presenting. Welcome. Good to see you both.
Good to see you as well. Oh,
That's right.
oh yeah, that's right. That's where it's
So we look forward to your presentation, and I know that, we're trying to work around with our schedule, so if we can highlight some of the most significant issues.
We'll do that for sure.
Thank you so much. The floor is
th-
yours.
Thank you so much for having us this evening, Dr. Musaitiv. A pleasure calling you doctor. So congratulations, and Board of Managers, we're very pleased to be here this evening. First, an acknowledgement to the previous presentation in strat planning. As a system and enterprise partner, we're very pleased that the Artmark and the shared branding initiative has moved forward. I think to the point that was observed in recent community forum, our communities and patients better understanding who we are, how we work together, and what we're trying to accomplish as a collective system is extremely important. So we're very pleased to have participated and gotten to this point. So thanks to Dr. Lee, thanks to Ted and the team. They really did a bang-up job. I'm going to turn it over to Tara. She's going to get started, and she has about 4 minutes or so to go ahead and get through her part of it.
Understood. And so real quickly, I'm going to go quickly through the first half of this presentation, which is really just sort of the highlight reel in terms of what we accomplished in the quarter January 1 through March 31st, including the fact that we continue to see increased need for care. We provided 127,000 face-to-face encounters, which is a 13% increase in visits over the same period last year. You'll see in your packet some breakdowns in terms of the demographics on what that looks like for the year to date. Next, I would like to highlight the fact that we went live with our new pharmacy management system. It's Willow. It's part of the Epic system, which really gives some really important benefits to our patients, including really integrated prescription and distribution functions. It allows physicians to be able to see across what medications individuals are on, at more seamless prior authorizations, and greater transparency for RevCycle. Last time we were here, we were able to acknowledge that we had received regional recognition as a top workplace. We were notified that we are one of the nation's top workplaces according to USA Today, based on the feedback that was received in the survey for our team, something that we really want to celebrate, just the quality and how hard we work to have an engaged and cohesive workplace. Next up is just to point out that we have received a clean third-party single audit, which is a requirement both for us as a nonprofit as well as our role as a community health center. And so we did receive an unmodified opinion and plan to post both the audits and the 990 forms associated with our tax status on our internet once we finish rebranding it. we look at equity, which is really at the core of everything that we do, and we look at those initiatives around SDOH. One of the things in dealing with food insecurity is the ability to connect with other partners, including the Central Texas Food Bank, bringing their mobile pharmacy to our sites, connecting more than 360 food insecure families to fresh groceries. And then I know that I've spoken about this in the past, but just to sort of reiterate in terms of the services at Colony Park, we are maintaining provider services until such time we are able to fully stand up services in the new Colony Park location. Go ahead, Jason.
And thanks so much, Tara, for all your efforts and work and the team's efforts around this. As mentioned, in the first 6 months of our fiscal year, we exceeded last year by almost 9,000 unique patients served, over 101,000 unique patients served for the first 6 months of the year. Supporting that, of course, is the Health Center program, federally supported in partnership with Central Health, us as the co-applicant, you guys as the applicant. One of the things that we continuously do is ensure that there's funding to support the program. Fortunately, in March, that was secured through Congress, and not only secured through the Community Health Center Trust Fund, but also additional to that was an increase of approximately $400 million in funding, which speaks to the efficacy of the program. And the federal government, through its Health Resources Service Administration, is already making grant opportunities available for which we intend to apply for. One is an expansion around behavioral health and substance use. That's due later in June. And then one that's very unique that we're excited about and already started conversations with Dr. Lee and our peers here at Central Health is actually for the very first time the opportunity for health centers to participate with reentry for justice-involved individuals. This has been years in the making. It's a one-time grant application, going to be highly competitive. There's going to be 40 across the country, one time, $1 million to support those activities. So we're working to figure out what that looks like for us. But for the very first time, based on policy, which is not yet approved, but is pending, is expected to be approved, allows for health centers to actually support up to 90 days before someone reenters from a carcerated environment back into the community. And so it extends services, there's a lot of advantages, so more to come on that. And what you'll see in this particular slide is the activities around the grants themselves and activities as it relates to how we compare to other health centers. What you'll see is our patient population is more low income at 98% versus 90%. What's staggering is the difference in English proficiency, 60+%, almost 64% based on current data as presented in the report. Not represented here, it's 60.6% or 61%, best served in language other than English, comparative to 26% across the country for all other health centers. We also have a lot higher number of individuals uninsured, and as we'll talk in just a moment, that's increasing, unfortunately, here in the state of Texas. One of the things that is a disadvantage for us is the state, amongst very few across the country, still has failed to go ahead and expand Medicaid. So that has a lot of impact for us. So what we're seeing then is a changing in our payer mix, which is, as we talked during the last quarterly report, continues that trend relative to loss of continuous Medicaid underneath the COVID-19 pandemic, which ended last May, on May 11th. And so what we're seeing is a substantive decrease in our payer mix. And actually, we're starting to see it rise and getting closer to pre-COVID levels where we were just back in 2018, 2019, 2020. So to a very small degree, it's almost like we experienced for some of our patients continuous Medicaid or Medicaid expansion during the pandemic. That coupled now to disenrollment as a result of the pandemic ending and some struggles with the state in terms of maintaining their ability to enroll folks has led to more folks falling off, which you heard earlier this afternoon as well. So you can see the trend lines where we were, got as low as a little less than 47%. Now it's popped back up over 50%. We do know based on, and that's the run rate for the year, the second quarter is actually higher in the written report that was included in your packet. So that, of course, leads to, well, how are we doing financially overall? There's a negative impact. We've had some coronavirus funding that ended at the end of March. That coupled to a loss of Medicaid payers at a higher rate or as a payer from a percentage basis has adversely impacted our financials. We knew that there was that possibility. We've planned for it, but we're anticipating that by the end of this year, we're going to have a range of $1.5 million to $4 million in deficit for this year. We have reserves to cover that, but there are other initiatives that need to be brought to bear, and I'll talk about that, assuming there'll be questions around that. So you can see the financials as presented within. Overall, what's interesting is we're surpassing our patient service revenues as projected for this year, though. Even despite the Medicaid changes, we're actually earning more monies than expected. That's on the pharmacy side, that's on the direct provision side, but we're also seeing more uninsured self-pay patients, and we need to close the gap on that. At the same time, we've also seen expenses escalate. We actually have less vacancies, which is a good thing. We only do what we do through the people who choose to work and stay with us, but we actually have a higher retention rate than expected, right? So that's an adverse impact on our budgetary means. And then we've seen an escalation in costs. We have more folks who are participating, which is a good thing, in our health benefits, but we're seeing it significantly go ahead and impact our bottom line as well. So when we start looking, one of the core things that we have as a health center with you as our partner, which extends beyond Travis County, is a core requirement to go ahead and assess needs within our service area. That is a requirement that is minimally required to be occurring every 3 years. So we just finished up, and we're still evaluating the preliminary findings, but happy to share some of those with you this evening. If you wondered what is the service area for community care as a health center partner to Central Health, relative to Travis County, this is it as it relates to Travis County. There's 55 zip code tabulation areas that are approved as part of our scope of project. And these are the areas for which the federal funds and all activities within our budget are required to be deployed. When we look on the next slide here, you can see that we've actually observed our target population, which are folks less than 200% of federal poverty or 2 times federal poverty. So in Austin, roughly, and across the country, except for Alaska and Hawaii, that means for a family of 4, it's an income level of $60,000. There's no geographic modifiers or changes based on cost of living. It's just straight up the same across the country, except in those 2 states. And what we've seen for those less than 200% trending back to 2012 to current, we've actually seen a reduction in our low income less than 200% from as high as 362,000 back in 2013 to now sitting and stabilizing at about 302,000. At the same time, the service area as a whole and the Travis County population, which is demonstrated here, is increased. So the 302,000 is for Travis County specific. It's not the entire service area. So we've seen a loss of about 58,000 individuals less than 200,000 or 200% of poverty over the intervening time, which means there's less folks low income. There's a lot of factors that play into that, and so we looked at that. One of the things that we've trended consistently for the last 6-7 years is something that we refer to as the vulnerable population footprint. We didn't invent this. The University of Missouri Extension Center did. It really looks at 2 factors that are predictive of a population that's most at risk for not just adverse health outcomes, but for outcomes in general. And so when we take a look at that is what's the percent of the individuals living in a census tract above poverty, or below poverty, I should say. So if it's a threshold of 20% or more of the population in that census tract living below poverty, coupled to less than 25% of the individuals in that same census tract not having graduated high school or its equivalency by the age of 25, that places a census tract as a vulnerable population footprint. When you go back to 2012 and 2013, we had 217 census tracts in Travis County. We had 43 census tracts that qualified based on that criteria. Yet fast forward to today, we now have 289 census tracts. That's in a 10-year period. That's a lot of census tracts added in a geographic area, which is really not heard of anywhere in the country. That just correlates to the extreme rapid growth in the area that we've all seen, experienced for those that have been in Austin during that time. Now it's down to 15 census tracts. So we went from a little less than 20% to now 5%. So that has implications. At the same time, as demonstrated on this side, we've also seen, based on census data, and we're going to qualify this in just a minute, but we've also seen a significant decrease in the number of individuals who are underserved less than 200% of federal poverty. It's decreased by over 50,000 individuals in Travis County to now about 79,000 folks based on the most recent census data. And this is derived from the 2018 through 2022 American Community Survey data, 5-year data. These are estimates. So the caveat or the qualification is we fully recognize that this is an underrepresentation of the populations we serve. Folks who are not residents or legal citizens are underrepresented in this data. But at the same time, you need to balance that the trend in the estimations are consistently applied, and yet we're still seeing it trending downward. So even if you put a multiplier and we said we do a synthetic analysis and we say there's 1.6 or 1.8 times as many folks, you're still looking at decreases overall over the time period, right? So this has implications. So what does that mean for us as a whole? One of the things for us to be considering is really thinking about how this actually impacts how we approach care. That's going to be one of the key findings. So we've all talked about gentrification, displacement, folks being pushed out of areas, historically underserved populations who've been thriving in an area over the years despite underinvestment. East Austin was a prime example. We know that East Austin has been gentrified and is still gentrifying. It doesn't take much to realize that. All we have to do is go down the street from here, right? Across from where the very first health center, one of the first health centers was East Austin Health Center. And we see the changes, right? But the other impact that is underestimated is this impact of dilution. So if we still have 302,000 folks and people are moving in and around them, all of a sudden what we're seeing is a dilution effect in terms of concentrated individuals living in poverty, lower income. So those vulnerable populations look like they're disappearing, but the people are not for the most part. And contrary to what we think is going on, the data is demonstrating folks are not actually leaving Travis County. There's a little bit of growth in Caldwell and Hayes County, Caldwell and Bastrop County for those below 200%, but Williamson and Hayes County in the intervening time have also lost folks below 200%. So the entire market, the MSA, the Metropolitan Statistical Area, has actually increased its affluence, which means it's more difficult for us to understand where folks who are lower income. So that challenges us at Community Care, challenges us at Central Health. How do we approach this? How do we take into account dilution effect? And when we take a look at it, we outlined in the report some of the implications in terms of cultural dilution, political dilution, and social influence, right? And so drawing attention to this as a need is going to be important for us moving forward. So it's just something for us to consider as a whole as we're looking at how do we structure and build and create a system that continues to be responsive. I share with colleagues all the time that if you're uninsured in Travis County, I feel strongly comparative to other markets that I've been in directly or as an observer, you're actually better off thanks to the support of Travis County taxpayers and the strength of Central Health with its partners, including Community Care. I can tell you without a doubt, it's easier for us to connect someone who's uninsured with specialty here than it was in the Twin Cities, than it was in Chicago, than it was, now it's changed because they have Medicaid expansion, so more folks are covered, but you still have folks who are uninsured, and it's still more difficult for them given the assets that have been brought to bear. With that stated, there's opportunities, and so we're happy to answer any questions you may have for us this evening, but really appreciate the time as always to be able to provide an update both in writing and then via presentation to you.
Thank you so much for that presentation. I know that you went quickly. There's a lot of information that you provided, and I want to offer an opportunity for everyone to have a conversation about the risks that we are foreseeing and how we will adapt. But I can speak, I believe, on behalf of every single board member here, what our priority is providing care for our community. We do not want to see any discontinuation of the care, the services, because of the financial impacts that we are expected, perhaps. So as Central Health, we do have reserves contained, but, and that is probably maybe, but it enables us to continue to absorb some of those risks. And that is why we always, I think the community, when we're talking about our reserves, and we see before us every time there is a risk that we may not have anticipated or expected, but that's really the business, let's say, if we're in. But primarily what we care for and what we aim is to continue with the services and provide the care for our community. So with that, I have a question for you. In terms of the expected loss with the Medicaid determination, you had an expected gap of 1.2 to 4, so that's a wide range. How certain are you? Do you think you may exceed that deficiency?
So it's a moving target for us because we have several things in play. One is the continued erosion of Medicaid coverage. It's starting to stabilize, and what the legislature did last year for postpartum and increasing it to 12 months, we're still analyzing because that started as of March 1st, but there's some stabilization there. Additionally, and I shared this with Pat earlier this week, we actually negotiated with the state an increase in our rate as a federally qualified health center for our Medicaid patients. So that's going to have a positive impact. So it's fluid for us right now. We do something that's referred to as a 12-month rolling projections. And so when we take a look at where we are, based on the last 3 months, it's estimated right now to be about 3.5 million as a loss for the year. We've got ample reserves right now to cover that, but we're also working with our partners at Central Health to figure out how better do we approach eligibility. Because we have folks who are otherwise Travis County low-income individuals who, for whatever reason, haven't been signed up for MAP or MAP Basic. There was a myriad of factors. One of them is candidly a reluctance for folks to actually participate. So as mentioned in the report through Tara and her group in partnership with Central Health, we want to run some focus groups to better understand, because there's some hesitancy around that. And some of that still stems from the public charge rule from 2018, 2019, and the last presidential administration. Coupled to that then is SB4, so concerns about immigrant status for many of our folks in participating in programs is an issue. And then there's also opportunities for us to enhance and make more effective our eligibility process. How do we actually get our financial screeners to do a little bit better by folks coming through? We've automated. We actually now have the ability and piloted in February and rolled it out in March, the ability for folks to go ahead and continue and sign up for our sliding fee scale, MAP Basic, through using MyChart. So there's some of those things that we're working with the Central Health team to go ahead and really fine tune, making things easier for our patients, community members to be able to sign up for benefits that they're otherwise eligible for. So that'll help close it as well.
Before I open it, just
Yes,
if
ma'am.
there's any additional, like, once you get more of a certainty in the numbers, if you can update us
Yeah, absolutely.
timely. Don't want to wait till the next presentation, so feel free to come at any time that you feel necessary, that there's any information that you should share with us.
Appreciate that. So
Thank
we'll
you.
probably plan on doing that through public comment next month. Just give
So
you an
thank you.
update
We
that
would
way.
appreciate
Or
that.
we'll do it privately through Pat.
However,
To you
thank
guys.
you. Appreciate it. So I
Okay.
am going to start with Manager Feldes.
Thank you. Jason, what you're saying is something that we have suspected, and as far as I'm concerned, known forever. Since the last census was taken, it was a joke. We know that the undercount exists. We know, especially if you were non-English speaking, or there was a question about your citizenship or residency status. We know that that was a problem. And at yesterday's conversation, community conversation, a couple of people who I spoke with who were non-English speakers were concerned that when they would go to our clinics, and I asked the people who were taking notes to please document this, that they were concerned because in the community, in their community, in their population of friends and circles of friends, they said that whenever they would come to try and get a MAP, or MAP Basic, whichever, and it was assumed or discovered that they were not citizens or they were not residents, that there appeared to be a hesitancy to extend to them the ability to sign up for resources, and that there was a question about eligibility. In other words, equals denial. And they're thinking, and these are what real people are experiencing and talking about. And I have heard that historically for decades through the pike in working with the immigrant community. But what you're telling me is that it's going to be even more important for us to develop a strategy with people working those uninsured communities and those populations that's signing up for eligibility programs to be more aligned to the population that they're going to be enrolling. Lived experiences is going to be very important. Making sure that the demographics of the employees or for community health and central health in enrolling and eligibility be much more aligned to our population. And that's, to me, what I'm hearing as not an incidental statement, but rather it has to be a strategic and targeted effort that looks at making sure that our population, our employee population, is more aligned with our demographics and better able to relate to the people that are coming in seeking care, especially when we're still talking about 200,000 uninsured in Travis County. And as you stated, you know, it was historically believed, oh, they're leaving Travis County in droves. I don't believe that they are. They're just not accepting services, fearful that someone's going to come after them, knocking on the door and deporting them.
Yeah, and I think that's part of the purpose of the focus groups, but I think our staff are very, and I'm sure Central Health are, but I'll only speak to community carers because that's where I have intimate knowledge. I think they're both reflective and representative of the communities that we serve and very responsive. But I think the fear is real. It's one of the reasons when the public charge rule came out, we did an initiative around Know Your Immigration Rights. We also have an initiative around Safe Place. So we need to double down, but to your point, we need to try to make this as low barrier as possible and to be very strategic in messaging. Tara, did you have something to add?
I did, just real quickly. I agree with what you've said. One of the unexpected benefits of the vaccine money that we received, both from the state and the federal government, allowed us to put together an outreach team that we have learned a lot about how to reach underrepresented communities, particularly the community that you speak about. And we're hoping to apply those lessons to this outreach as well.
Thank you
I
so
appreciate that.
much.
Thank you.
So, managers, in light of our limited time, is there any hard pressing questions that you have? Or can that wait, or we can follow up with you? Manager Jones?
I just would like to see if I can meet with you offline to discuss this, because there's some data that seems to be conflicting that I'd like to talk with you about, but I'll do it offline.
Thank you, Manager Jones. Maybe Brianna can assist with scheduling that. Thank you. So with that, I see no pressing questions. Thank you, Jason. Thank you, Tara. I really appreciate you all, and thank you for the work you do. Appreciate it.
Thank you. Appreciate you guys.
Now, moving along, members, item number 4, receive and discuss a presentation on the fiscal year 2025 preliminary budget and the financial forecast for subsequent fiscal years, including information on possible property tax rates to be assessed. Jeff Canoto and Nikki Riley will be presenting. Managers and community, this is the start of our lovely budget season. We are starting early to be more proactive and to ensure that we have crossed all the T's and dotted all our I's. So thank you, appreciate you. So today is just a presentation. There's not an action associated with this item. The floor is yours. Thank you.
Thank you. You took some words right out of what I was gonna say. That's perfect. This is the beginning of our fiscal year 2025 budget process. We're honored to kick that process off with you. Today's presentation is a real high-level financial forecast. And again, as the chair stated, we're not requesting action, but you will see that we have some pretty accelerated timelines as we move forward, including the proposed budget that will be back here in a couple of weeks. So just a couple opening comments related around financial forecast, and you'll hear this in our presentation also. It's really a high-level look at forward-looking trends over a long period of time. There's a lot that we don't know. We're really trying to put big picture assumptions into a model and look at trying to identify any financial trends that may exist, and also look at our reserve levels, which I would characterize as a savings account. And you've heard some comments tonight about some of the risk associated with healthcare. Our forecast allows us to, as we examine both our financial trends and our reserve levels, it helps us look at risk associated with, you've heard tonight, some known risk, but there's always unknown risks that exist. A lot of that risk, Central Health doesn't control, or neither do the entities. The entities are affiliated entities, but as we look at risk, that risk exists for both those entities and Central Health, both across our Sendero and Community Care and other associated entities. So again, as a looking at trying to address some of the risk, there's a really large need in our community to provide services, and we need to have the adequate resources, both financial and from a personnel and a healthcare delivery system capacity, ability to deliver on that need. So with that said, again, the financial forecast is just this, the start. It's a precursor to our budget process. And the most important thing is there's nothing set in stone. So this is just a tool that lets us set our tax rate for our proposed budget. And it is simply that, a proposed budget that can change throughout the budget process. So with that, I'm going to turn it over to Nikki to go through some initial slides.
Hi, good afternoon. I'm Nikki Riley, Deputy CFO. In the presentation, I'll start off with best practice for financial forecasting. That is set out for us as a governmental entity by the GFOA. And I just wanted to let you know that for fiscal year 23, our budget department did receive the Distinguished Budget Presentation Award from the GFOA, so I wanted to mention that. It is something that is prescribed for most governments, and it was recommended by Travis County, and so that is the publication that we send in our final budget document. So GFOA recommends has many requirements and recommendations for setting off the forecast and the budget process. The forecast helps us aid in the evaluating current and future fiscal conditions, helps us evaluate what we're doing over a long period of time. It presents future financial estimates to help us evaluate our trends, our risks, what objectives you have as a board of managers, what revenue is coming in, and all the expenditures that we expect to, especially with our health equity plan. And it allows us to take a longer view of what we need so we can smooth things over a longer period so we don't have volatility in our budget process. We need to set out objectives in accordance with that plan. We're gonna do our forecast from fiscal year 25 to 2030, which is a 6-year forecast. We are trying to figure out our known and unknown risks and help mitigate those from the onset. We evaluate our reserve levels to help determine if we're going to have enough for our the risk and for our patients and their healthcare needs. And then we'll recommend an initial property tax rate to prepare for the budget process for fiscal year '25. The next slide, I believe you've seen before. It's the SWOT analysis for Central Health that Dr. Lee and Monica has shown you before. It shows some of the things that we need to take into consideration with our forecast. The changing landscape is definitely has some issues that we need to think about. Addressing homelessness, I think, is a priority, and our shifting demographics that we need to plan for. The workforce competition and our market conditions also are reflected on our budget process, and definitely regulatory and funding policies. The resizing of the federal funding pool and supplemental payment programs is definitely changing, and we need to be able to have the reserve levels to be able to accommodate that. Next slide. Some of our driving force risk areas that we are really thinking about with this budget process is the inflation. Are we in a recession? The workforce competition, provider shortfalls. Are we going to be able to obtain the providers that we need to implement the structure for the health equity plan? And definitely we have seen a shortage in the supply chain over the last several years, and in the increase in costs related to that. Property tax funding caps are always fun to discuss during the legislative sessions. We've managed to bystep that, but those are always on our minds as far as legislation. And then the future supplemental program funding levels that could result in the value of services shortfall for us. And the risk-based capital requirements. We just need to make sure that we are planning for any issues with that. Next slide. So this is the second year of our 7-year health equity plan. We have significant financial and personnel investment that is required for doing what we want to do in the health equity plan. And the supported infrastructure of actually providing those services with the new clinics that are coming out and all the new providers that we need to fill those clinics. We've adjusted to augment service delivery by accelerating services. So there is quite a lot to be done in fiscal year '25. And that is to meet the needs of our patients. We're trying to also develop other opportunities and leverage those for the future for our patients.
Okay, next slide. Thank you. So, so now we're gonna get a little bit more into some detail of the actual forecast. So, let me take a step back and just talk a little bit about the process. So, this year, when you look at the, that timeline, up at the top of this, slide, you see a lot of circles and some fiscal years. And so what does that really mean? What it really means is we looked at fiscal year '24 and we looked at doing can I call it a preliminary estimate of where we'll end up in fiscal year '24. And then we tried to gauge, based on that estimate, looking out over the next 6 years, fiscal years '25 through 2030, for our financial forecast period. And we tried to gauge from a reserve level standpoint where we'll end up over the forecast period. And so as we looked at our fiscal year '24 estimate, a couple things came to light. One is that our interest income has been significantly higher both last year in fiscal year '23, and it continues to be higher in fiscal year '24 due to really just increased yield rates on investments, and it hasn't been volatile, or in other words, the rates have increased substantially and they've stayed at those higher levels. So that's one factor that's going to lead to us having a higher reserve level in '24 than what we budgeted. And then secondly, the second major element is just delayed openings of some of our clinics have resulted in lower than expected budgeted expenditures. So taking that into account, one of the things that you, the board, challenged us with, and Dr. Lee has challenged staff to look at, are there areas of opportunity where we can accelerate services? Are there areas that we can expand services based on opportunities that exist or need that we're able to meet? And so I'm not going to read through all the areas, but this is down below in the bottom half the bottom half of this slide, you'll see a number of areas that we're trying to work on accelerating in fiscal year 2025. And quite frankly, it's a pretty lengthy list. And but I think it goes to showing organizationally how we're trying to move quickly to use some of the financial resources that we have and some of the opportunities that exist to try to accelerate some of the services that you as the board challenge staff to look at. Next slide. So some of the assumptions that we use, some of these are kind of boilerplate assumptions, but just kind of walking through a number of them. On property tax revenue, which is our significant source of revenue, new construction has always been a fairly high level. We have, just due to some of the economic conditions, some of the assessed value additions will be lowered over the forecast period. And then has been a standing practice over the last several years, we've looked at trying to set a steady tax rate that has a year-over-year increase rather than trying to have volatile or up and down years where we may not be able to have the necessary resources to provide services in any given period, and instead looking at a real smoothing process in order to have a steady long-term look at our resources and the services that we are planning to provide. And then the third bullet point is kind of well, let me just read it and tell you what it is. So let me explain what it is. So in the past, over the last several years, we've had valuations, taxable valuations on all types of properties. Non-homestead properties have increased significantly, and they've increased significantly, even higher than any tax rate increase that we've had, which has really meant the tax rate has gone down. And I think when we had our 5-cent increase, I think our tax rate was right at almost 12.9 cents. Today we're at a little over 10 cents. So our tax rate has gone down. We all know that economically we've had a downturn, certainly in valuation of properties. So what does this bullet point mean? It really means that we've had a lot of rising prices. Our homestead properties are capped at a 10% taxable increase year over year. The fair market value of the homestead properties has increased much faster And there's a significant gap between the taxable value and the fair market value. In the past, even though technically you could argue homesteads are increasing by 10%, non-homesteads, and I'm talking about commercial, multifamily, industrial, all of those type of properties have increased substantially, and they've helped kind of subsidize our tax rate. That condition has stopped. Now, the non-homestead, the commercial, the multifamily property, a lot of those values are flat or are decreasing slightly. So what does that mean to the homestead? Well, it means that there's still a significant gap between taxable value and fair market value. And even though maybe homestead values are flat or decreasing, there's still a lot of gap that may cause a lot of homestead values to still increase 10%, the 10% cap, because of that difference between fair market value and taxable value. So what does all that mean? It really just means that on the homestead segment of our taxable property, they may endure more of the burden in this year because other types of properties haven't increased near the 10% rate that has existed. So apologies for a lot of detailed information on that, but that is something that we'll want to look at as we get property tax information from the appraisal district. And then other revenue, I've mentioned higher interest income, and we've assumed increases over previous years. Continued tobacco settlement payments, our ground lease revenue, we'll continue to see that. We have reset our parking garage lease revenue, but the CEC facility will be conveyed back to or returned back to Central Health, so that lease revenue, the lease term on the CEC will discontinue beginning fiscal year 2025. Next slide. And then just continuing on quickly through some of the other assumptions. We talked about inflation being a risk factor. We've estimated inflation 3 to 8%, depending on what type of expense. Continued funding enrollment for our ACA subsidy programs with Sendero. Rosewood, Zaragoza, and Del Valle will be operational in fiscal year 2025, and other clinical sites will come online, Hancock Colony Park and Cameron Center in future years, and increases to purchase services around primary dental and specialty care. And then just appropriate increases in salaries and benefits. And then just other assumptions would be around Sendero risk-based capital, as we have a additional assumption in for 2025, but no subsequent risk-based capital after 2025. And then last but not least is an assumption that we will cash fund some of our capital projects that we anticipated in previous forecast of debt financing. And so this is kind of the second part. We've accelerated services in 2025, and we're proposing to cash fund some capital projects that will result in significant interest savings related to that. But that's what we're evaluating our fiscal year 24 estimated ending balance, and those are some of the uses that we're capitalizing on for those higher than anticipated balances. So next slide. So this is our standard format of our targeted days of reserve on hand. Just to orient everyone, on the left are days of reserves on hand. And then we have our forecast period beginning in 2025 through fiscal year 2030. The red line, so there's 3 lines. The red line is what we showed last year. So that's where we ended up. We had a 6.5% increase over the no new revenue rate. And by 2030, we ended up in the targeted days of reserves on hand green area. We did two scenarios for 2025. We looked at a 6.5% over the no new revenue rate and a 5.5% rate. The purple line is the 6.5% rate, and you see that that falls by fiscal year 2030, falls pretty close to where we were from last year's forecast. And it's also within the targeted area of 120 to 150 days. And then you'll also notice the blue line, the 5.5%. And again, this is a rate year over year. You see that amount falls below our 120 to 150 day targeted days of reserve on hand. So, next slide. And so this is a chart of our 6-year sources, uses, and reserve levels. And so, again, this is a forecast, a real high-level look at our finances. You see that reserve levels, which is the green line, track down over the forecast period. And this is consistent with what we've been saying, that we have a long-term plan in order to provide care and meet the needs of our community through our health equity plan, and that we have a significant spend in order to achieve that. And so that's the spend down of our reserves related to that plan. And then you see on the top, the orange line and the blue line are our sources and our uses, and you can kind of follow that on the table below. But you see that we have, beginning in 2025, we have a larger gap, a $77.4 million gap, due to some of the capital, the cash funding of our capital projects. And then you see the gap starts to close, but then it kind of stays constant over the life of the forecast. But we wanted to show you a picture of what at least our forecast period look like, and our sources and uses estimates, and the impact of that to our reserves. So that's what we're showing on this slide. Last but not least, our calendar. I think we showed, I think this calendar has been shown before. We're in May. We're in the red highlighted area called Present Financial Forecast. We do have an upcoming event Friday related to board recommended emerging priority submission. That deadline is, I believe, May 24th, so that's this Friday. So just wanted to point that out. And then the other part of it is we'll be back on June 12th to present the fiscal year 2025 budget, where we'll have a lot more detail on our plan for that upcoming year.
Well,
So next slide, just wrapping up our proposed recommendation.
no,
Oh, I'm sorry.
you can finish that up and we'll take,
Okay,
Thank
thank you. So just as it relates to, what's next, staff, based on the reserve analysis and our sources and uses, staff plans to prepare the fiscal year 2025 budget at 6.5% over the no new revenue rate. And again, we're looking at areas to accelerate services. But again, this is a proposed budget with a proposed initial rate. And again, there's nothing that preempts that from changing during the process. So that concludes our presentation. Thanks for letting me get through the presentation.
Thank you
and,
so
turn
much.
it back over.
Appreciate it. It is 5:30 p.m. and we have a time certain public communication. So do I adjourn this meeting? So I am going,
Recess, sorry.
so I
You
am.
adjourn, you can't come back.
Okay, thank you for that clarification. So I am recessing the Budget and Finance Committee meeting, and we will return if there's any additional questions related to this item. So at this time, we are 5:31, so not bad.
Second, do we have to open up another meeting to do this? She's already recessed. Oh, okay, well, I'll do that. Oh, okay, I am calling to order our Board of Managers meeting on May 22nd at 5:32 for the purpose of taking public communication. I'll just go ahead.
Yeah, go ahead.
So, as we said before, we're receiving public communication for all of our committees, the Strategic Planning Committee, Budget and Finance Executive Committee, and the Board of Managers meetings. Members of the public who wish to make comments virtually during the public communication portion must have registered with Central Health via the online form or by telephone no later than 2:30 today. So today, as part of our public communication, we will continue with our Mission Moments series, which is where we're hearing from staff or patients or community members that share their stories with us. So about how our mission is connecting people to healthcare. It gives us the opportunity to really personalize and understand what we're doing to serve people. So today, we're going to have, let's see. And also, because May is Asian American and Pacific Islander Heritage Month, we're going to take some time to highlight the contributions they've made in the Austin community. So first, I think we'll take our public speakers. So Yesenia, can you please introduce our speakers for this evening?
Yes, thank you, Chair Kitchen. I will first read off today's guidelines for this meeting's public communication. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number after your introduction. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will continue and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. And first speaker that we have right now, I'm gonna call up, let me see if she's on. I have Kat Gibbons. If you could please unmute. Kat Gibbons is gonna be online.
Okay, yes. Hi, I'm Kat Gibbons. I am from Senacor. I am the outreach manager. We are a substance use disorder treatment program located in North Austin, and our mission was founded on serving the uninsured and underinsured population. So we do share the same values as Central Health when it comes to making healthcare accessible for all. That being said, for the uninsured/underinsured client, options for substance use disorder treatment are extremely limited. Senacor is the only facility in Austin that provides detox for uninsured clients. We have a contract with Health and Human Services that allows us to serve some of our population, but it only gets us so far. As you are all aware, the epidemic of addiction continues to grow, and we are seeing it happen right here in our city. Take the recent overdose outbreaks, for example. Travis County has the highest rate of fentanyl overdose deaths in the entire state of Texas. We need more resources allocated to substance use disorder treatment. Senacor is asking for a partnership with Central Health to be able to provide inpatient detox and residential treatment for the people that are unable to access this care otherwise. I am a person in long-term recovery. I am also a person who is long-term uninsured and unhoused. I can say with certainty that I would not be here today if I was not able to get a scholarship for inpatient detox and residential treatment. But the fact is that these scholarships are few and far between, and most people do not ever get that opportunity. Everyone deserves access to quality substance use disorder treatment. So I'd like to work together to make that a reality. Thank you very much.
Thank you so much, Kat. Up next, I have Sunny Ali, who is there in person. They signed up to speak in person. Sunny, are you there in the boardroom? Or online? Sunny, if you're online, can you please unmute? I don't think I see Sunny.
So
So then
Sonny's
we'll-
not in the room.
Okay, so we will move on to our next speaker. So this is Veronica Butron Camacho, who will be giving a mission moment for Central Health.
I hope everybody can hear me.
Try to get a little closer to your microphone. You just sound a little muffled.
So, how about now? Can you hear me better? Is that clear?
We can hear you. You're a little muffled, but we can hear you.
Okay. Okay, how about now? Is this better?
Yes.
Okay, great. Hi, thank you for having me. I want to share this mission moment. My name is Veronica Butron Camacho, and I'm the Director of Case Management here at Central Health. And I would like for you all to meet Kathy Edmondson, who is on this photo, one of our health management liaisons and community health workers here at Central Health that works on our team. Kathy has been working as a community health worker in Central Texas for over 20 years. Very experienced with this population. This is very much a passion of hers. Kathy also just recently received her community health worker instructor certification. She recently told us that one of the most challenging yet rewarding cases she's worked on is that of a 69-year-old West African man battling homelessness, family isolation, and severe congestive heart failure. She mentioned when this patient was first referred to our team in 2019, he had been in the hospital countless times for his CHF exacerbation or congestive heart failure exacerbation. He connected with Dr. Kwong at the Arch Clinic, but kept getting discharged to unstable living environments after he would go into the hospital. Kathy and her colleagues became his advocates, determined to break that pattern. Kathy accompanied this patient to every appointment, educating him on his disease and the importance of medication adherence. They fought tooth and nail to get him into the safest possible facilities. It was definitely an uphill battle. In 2020, he was discharged to a boarding home that refused to allow us, the care management team, inside to monitor his care. That following year, that particular boarding home closed and the patient landed in a motel room, virtually cut off from our oversight. Kathy filed an Adult Protective Services inquiry, realizing more drastic measures were needed. Sure enough, in early 2022, after another visit to the emergency department, hospice reached out with a great concern about his condition. That's when we put our foot down. We transitioned him straight into one of our facilities, Fresh Start. The difference was night and day. With a stable environment, his health financially achieved consistency. As of March 22nd, he went 2 full years without another hospital admission. And that is my mission moment.
Thank you. Thank you. We appreciate hearing that.
Thanks so much, Veronica. Up next, we have another one of our wonderful colleagues, Kent Kaziski. And I believe he's in the room. Yes, I see him.
Good evening, managers. Again, my name is Kent Kaziski, the Enterprise Manager of Diversity, Equity, and Inclusion here at our enterprise, supporting all of the wonderful employees across our enterprise. I'm here to highlight the work done internally for Asian American and Pacific Islander Heritage Month, as well as the upcoming Memorial Day holiday that we're going into. This month, the DEI Council is highlighting the vibrant, diverse, and resilient communities that have been part of the American experience for more than 200 years, including those who have origins in 2 continents, more than 50 countries, and are inclusive of over 20 million Americans. But it was really important for us to highlight that while the AIPI community is really critical, it is not a monolith in itself. And while that terminology might be a catch-all, we are going to be carving out time and space to understand individual differences and individual cultures within the AAPI community. Specifically for 2024, the theme was advancing leadership through innovation. And this builds off previous years where they focus on innovation, resiliency, and pioneering leaders within the AAPI community. So for our DI Council, we are excited to host a Lunch and Learn next week for all of our enterprise employees to hear about the different representations within the AAPI community. Specifically, we're also highlighting employees across the enterprise about their leadership experience, how culture has influenced their personal and professional development and approaches, and overall how to support this community. And I also want to spotlight, we have an amazing manager, Matwani, joining us next week for our employees, who will also be one of those leaders talking about our representation. Well, I'm really happy to say we have representation from Sendero, Community Care, and Central Health, highlighting the wide variety and perspectives throughout our individual communities. I also want to quickly recognize and give a nod to that we are entering the Memorial Day holiday this weekend. Our DEI Council is also working to inform employees about this work and how we can all remember and honor those who made the ultimate sacrifice. So all of our offices will be closed on Monday, but I ask all to take a moment to reflect on those in your life who have served or maybe may serve, and really to take a moment to reflect on that going into the holiday. I also want to thank the DEI Council. It's not just me, it's my amazing colleague Imelda Mahalka and about 32 other representatives across the entire enterprise who are doing this work. I know we're making a greater and a more inclusive workplace for all of our employees, and I'm excited to bring more and more of this work to you monthly. So thank you.
Thank you.
Thank you, Kent. And I'll just do one last call for Sunny Ali, if you're in the room or online.
We do not see Sunny, so.
Okay, I will be sure to get in touch with them. And last but not least, we have Chair Ann Kitchen.
So I wanted to take a moment to talk about our 20th anniversary and introduce our cake that we have behind us. So let me just say that as we talked about before, this year Central Health celebrates its 20th anniversary. Voters created the Travis County Hospital District on May 15th, 2004, with its first board meeting on August 2nd of that year. I know that many of you were around and during that time, and many of you were leaders in our efforts to create the hospital district. And that it was although the words that were used at the time were not healthcare equity per se, it was very much a part of the thinking at the time in creating the district. So there's been much work done over the last 20 years by our first board of directors and every board of directors since then, as well as our wonderful staff and our CEOs over the years. So it's because of that foundational work that we can do the innovative work that we're doing right now. And it's foundational work about creating Sendero, creating Map Basic, creating the Health and Wellness Center concept, becoming an RHP hub for the 1115 waiver, and a founding partner of Dell Medical School. So all this work that came before us in the 20 years before us is underlying what we're talking about today and into the future as we work on our budget this year. So, and I want to just end by saying that we all know that through our healthcare equity plan, we're providing more care for more people in more places, and we're producing better outcomes for people because it's all about people being able to live a healthy life in our community. So what we have today is, well, first off, let me say also that we will be celebrating our 20th anniversary in August. So during the executive committee portion of our meeting today, we'll have a few more things to let you know about that and our timeline for talking about the August celebration. So we'll do that then. But now we have cake to share. So I think what we're going to do is take about let's say a 10-minute break. It's 5:45 now. So a 10-minute break, a few minutes for all of us to get in front of the cake, and some brave member of our board of managers can hold the cake up, and then we'll take a picture, and then we'll have a few minutes of break if people want to get food before we come back. So, and then when we come back, we will be recessing the Board of Managers and moving back to the Budget and Finance Committee. So, let's take a picture.
Try to get a group picture. And I think we have to sing happy birthday. Chairs up, yep.
Yeah, I think we're gonna get started. I was waiting for Maram so that we can, because she needs to come back into. Okay, David, do I need to? Okay, so managers, we're starting back again. We're recessing. I don't know where Maram went. We're recessing the,
Day and time to come back, right? No, recess.
yeah. No, Board of Man. We're recessing the Board of Managers meeting and going back to our Budget and Finance meeting. So we're gonna pull up our Budget and Finance Committee meeting. Is she coming back? Okay. I think that in the Budget and Finance Committee meeting, we were on the item number, let's see.
4.
We were in item number 4, related to our budget and financial forecast. So we have our chair back with us now. And we're back in session for our Budget and Finance Committee on item number 4.
If the chair went to get a chair.
Okay. Okay.
Okay, so you brought us back in?
Yeah, we're back in on item number 4. I don't know if you want to move
Okay.
forward from that or.
So, members, do you have any questions for Jeff, or can we hold off on those questions? And yes, Manager Matwane.
I just have a comment that
Yes.
I just wanted to commend the financial organization over the years for, I think, very healthy and conservative stewardship that has allowed us to be able to, although unanticipated, obviously, net some windfall that enables us to turn and burn and as much as accelerating, and having that luxury to be able to do that while still maintaining pretty amazing fidelity to the projections, and just underscores my faith in the recommendations that come from the financial organization. So thank you all so much.
Thank you. I echo that as
Hear,
well.
hear.
Manager Valdez.
Jeff, not today, but maybe Madam Chair, if you could tell me if we're going to have a separate meeting so that we can talk about how the budget, the financial forecast ties to our real estate and property investments, and our expenditures ties to our sources, specifically on that.
Okay.
I'd like to know if we could have something like that.
Sure. So maybe at our June meeting, if we can have some. Yeah, we'll have it further. Again, as I mentioned, this is just the kickoff of our budget season for fiscal year 2025. So we'll take that into consideration. Any further questions, Manager Jones?
Yes, could we get a profile of the top 5 hospital districts, percentage of expenditures in terms of operations and comparative to us? I know as part of the budget process we do that, but I'd be interested over the last 5 years, if we could get a profile of that
Top 5 in state?
in the state, yeah.
Can I ask, just to clarify, are you talking tax rates or proportionate amounts of overlapping, or are you talking about just expense trends?
No, the tax rate.
The tax rate?
Yeah.
Okay. Yeah, sure, yeah, we provide that every year, we'll pull that out
Yeah.
and just show a progression.
I think it's important, well, yeah, okay, thanks, I appreciate
And
it.
following on that, as Manager Jones always wants to make sure that we document, we don't own, operate a hospital. So you can make that distinction clear on the slides. Thank you. Any further questions on this item? So I see none. Thank you, Jeff. Thank you, Nikki. Appreciate it. And we'll see you again next month. And as also a reminder to board members, if you have any item requests, please submit it by Friday. And if you have any issues or problems, please reach out to Brianna. Thank you. Now moving on to item number 4, I believe. Oh,
Item
I
number
have,
5.
sorry, I had.
We just finished 4.
Katie, oh, I'm actually looking at the wrong. Oh, our papers got shuffled. Thank you, my apologies. Now, moving to item number 4, receive and discuss a presentation on the fiscal year 2025. We did that. 5 is to receive a presentation on the April 2024 financial statements for Central Health.
Yeah, there's no presentation.
Members, there is no presentation on this item. The financial statements are included in the backup material. If you have questions, speak with Jeff Canoto or Nikki Riley offline. So, moving on to item number 2. As I mentioned, we went out of order, and that is receive and discuss the quarterly financial and operational report for Sendero Health Plans. Karen Atur will be presenting. So, are we gonna be open first? Okay, so please, welcome.
There you go. Thank you. They are in a meeting that we'll discuss during a closed session, a confidential meeting. Next slide, or can I? Okay, there we go. We first, for the first quarter, want to note who our board of directors are for 2024. It is Juan Gazer as our board chair. Garza. Gerald McDonald is vice chair. Betty DeLargy is a board member and our immediate past president. Jeff Canola is a board member and the CFO of Central Health. Amit Matmani is our board member, Board of Managers, Central Health. Mackenzie Frazier, a board member. Molly Hahn, board member. Dr. Patrick Lee is an ex officio CEO, Central Health. And Ann Kitchen is ex officio board chair, Central Health. As I mentioned, our executives are not here today. A few of the items we wanted to point out for Q1 2024 is that we are enhancing our control of cost, implementing budgets to our actual comparisons for each department. And our first quarter, we are under budget by 21%, and I'll go into just a little bit more detail in just a moment on that. Our staff is also going to be focused on our NCQA audit occurring later this year. That is a big focus for our plan, that we take a lot of great pride in being NCQA accredited. To give you a snapshot of our membership and enrollment, in December 2022, we were at 6,158 compared to December 2023 at 6,159, so very consistent there. For April 2023, we were at 6,742 members. April 2024, we had a significant increase. We met our goals at 12,628 members. So very excited that we were able to accomplish that. For our 8-county distribution, we have the 12,628 members, and I'll just point out that the majority of our members at 62% are Travis County, and then they're spread out throughout the other counties around the region. The ACA 2024 enrollment data is how many members are in ACA in each of those counties within all of the health plans that are offered. And so you will see that in Bastrop, we have our largest percentage at 12.2, but overall, between the 8 counties, we are at 5.7%. For our Q1 budget and actuals finance review, it was an overall 21% below the budget. I did want to point out a few items. We are a little higher on salaries and benefits and on our computer and IT. Part of that is for our growth, and then we are bringing in the TPA functions to process claims and services for both Central Health and Sendero Health Plans. So that initial cost has been driving up the cost there. But we have been having some reductions, one being for the outsourced services, and a lot of that is for our claims. The reason that is potentially a little low right now is because of the breach that Change Healthcare had earlier this year, and it slowed down the receipt of claims. So that's part of the reasoning on that. And then our finance fees are down 98%, and that is because we've not had to request financing from Central Health at this point, which we're very pleased about. And questions?
Thank you so much. Appreciate it, Karen. Manager Valdez?
Is it possible for you to tell us at some point in time, not today, but the demographics of your membership?
Yes.
For Travis County and also for the other counties?
Yes, we will bring that to the board. I do want to mention as part of that demographic, just in case, our COO, Tara Thomas, provided me with our CHAP expansion membership, our MAP basic membership, and our HAM membership. So our CHAP expansion membership is at 778, so it's 6% of our membership. Our MAP basic is at 454 members, so it's 4%. And HAM is 9% at 1,139.
Thank you for that.
And we'll include that in the demographic information we send over.
Thank you. Any further questions, members? So, yes, Dr. Lee?
Thank you, Chairman Saitov. I just wanted to thank and congratulate the entire Sendero executive team. I've been just really a huge fan of the professionalism, the collaboration, and the focus and efficiency of your work. It's showing up in the numbers in spades, but I think I have a great deal of confidence in your leadership and appreciate all the work. Thank you.
Well, I think that goes both ways. We're very appreciative of the collaboration between Central Health and Community Care. That has been a wonderful resource for us and our members.
Thank you so much. I love a lovely family. Well, so,
And we're gonna have to get you a new one with the new logo then.
okay. Well,
Yes.
members, that concludes our open meeting. Now we are going into closed session. I announce the board is convening in closed session to discuss agenda item number 2 under Texas Government Code 5. And it is May 22nd, 2024, and 6:09 p.m. So, and let me know when you're ready. Okay, perfect. Thank you. We are out of close, well, it is May 22nd, 2024, and 6:22 p.m. We are out of closed session for item number 2, and there were no there's no actions for this item. So at this moment, I am moving forward with agenda item number 6, confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, June 12, 2024 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas 78702. At this time, I am ready to accept a motion for adjournment. Chair Kitchen moves and Manager May seconds. Any discussions? I see none. All in favor? Aye. Meeting adjourned. Thank you.
Managers, as I begin our next 2 meetings, you're going to see me moving fairly quickly. We're running a little behind, but the other concern is we have at least 2 board members that need to leave early, and we also have a storm coming. So I don't know how bad it is, I can't tell, but for those of you who maybe live north or northeast, you might need to look at the radar screen. I've asked Perla to check for us. So when you check, just let, okay, you guys let us know. So I'm gonna move pretty quickly. Okay. Good afternoon. Today is May 22nd, and it is 6:24. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. So, first item of business is approval of the minutes of the Central Health Executive Committee, April 24th, 2024 meeting. Dr. Martin moves approval. Dr. Musaidov moves second. All in favor? Aye. Second item is to review and provide direction to staff on the prioritization and tentative scheduling of items for consideration at future Central Health Board and committee meetings. So there's no motion necessary for this item. The item's in your backup. There is one item that I want to bring to your attention. Perla, do you want me to talk about it, or do you want to talk about it?
I can talk about it.
Okay, go ahead.
Managers, I'm asking for you all to save the date. We have a day now for our 20th anniversary celebration. It will be scheduled for August 30th. We're planning for a noontime, lunchtime community event. So what we're going to do is ask Ted and his team to come back at our next board meeting to present draft a memo, but also to present an update on what the plan is for that event, so you are informed about what's going to happen. If you have any ideas, please feel free to share them with Brianna, or we could also schedule a check-in with Ted if you'd like. But they're in our very professional communications and engagement team is currently in the process of putting this event together.
Thank you, Perla.
Yes.
So we will look forward at our June meeting to discuss more details. In the meantime, I encourage each of you who would like to reach out to Brianna or Ted or Perla if there are any suggestions you all would like to make about the celebration. So thank you, Perla. Yes.
Noon. August 30th. Save the date.
Yeah, she'll send that out. So if you can send that, if you'll send the save the day out to us also, then we'll discuss more details at our next meeting. Okay?
The celebration for that day. We had talked about the possibility of having a series of meetings over time. This is just for that day.
Yes, so we will, yes, exactly. Okay. Okay. All right, we'll move on to item number 3, which is confirm the next regular executive committee meeting date, time, and location. So managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, June 12th at 4 p.m. or immediately after the Budget and Finance Committee meeting at Central Health Administrative Offices, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment. Motion from Dr. Musaidev, second from Dr. Martin. All in favor? Aye. Okay. All right. So we're going to move on to our Board of Managers meeting now. Good afternoon. Today is May 22nd, and it is 6:27. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. It may be, David, for procedural purposes, we had it before, we recessed it, so now we're reopening.
Reconvening, yes.
We're reconvening our Board of Managers meeting. So, our first item of business is the consent agenda, which is the approval of the minutes and approval of receive and ratify Central Health investments for April 2024. Do I have a motion? Motion from Manager May, a second from Manager Matwani. All in favor?
Aye.
Aye. Okay. We'll now move on to our second. Well, if Dr. Lee, if you, let's see, I think we were gonna take the opioid settlement first. Is that acceptable to you? Okay. And that is item number, what is that item number? Pardon? Oh, that's item number, I thought I just did item number 1. Oh, okay. It's listed on the regular agenda as item number 1. Sorry about that. The item is to approve a resolution necessary to accept opioid settlement fund distributions from the comptroller and naming Dr. Patrick Lee as the person with authority to act on behalf of the district in relation to the funds. Katie Coburn will be presenting.
Does red mean it's on? Yes. Yeah, oh, thank you. Okay. So thank you, managers. Very briefly, you all may remember I came before you a month or so ago to let you know that as a Chapter 281 hospital district, Central Health will be receiving an automatic allocation from the opioid settlement funds from the Texas Opioid Abatement Fund Council that the comptroller manages. We will be receiving about $3.9 million this year in this first distribution. And in order to accept those funds, the Board of Managers needs to adopt a resolution that is before you in your packets. This is straight from the template that the comptroller requires that hospital district board managers pass. And as the motion says, it names Dr. Lee as the primary authority who can act for the district and agrees that we will be using the money for its intended purposes as laid out in rule. So that's all we need. So it is an action request for this evening.
Okay, that's exciting to have those funds. Can I have a motion? Okay, moved by Manager May, seconded by Manager Matwani. Not seeing any questions. All in favor?
Aye.
Okay, it passes. Thank you very much. Okay, our next item is item number 2. Receive an update from the Central Health President and CEO on his first 100 days. Dr. Lee will be presenting.
Good day, everybody. It's such a joy to be here with you and get to share these brief reflections with all of you. I want to begin with a point of gratitude. I sat in this, I believe, at this very chair about 6 months ago, and I'm grateful for you all entrusting me with this responsibility. It is already, a singular honor and privilege to get to serve in this role. So thank you so much. I also want to add a huge point of gratitude for the team You'll see in what follows a collective effort to invest in me so that I can then add value in this role for the organization. I want to begin by acknowledging that team. Team, you make me better every day. I'm deeply honored. Thank you for all your work. Even today's presentation this morning looked different than it does now. It is now on our new Central Health PowerPoint format. I think it looks beautiful. And I want to thank Diana Burno and our communications team for doing that quick turnaround literally hours before today's meeting. So thank you, team. I also want to begin with a note of optimism. As I will go into further detail in this presentation, there's a great deal to be optimistic about. I believe our position and our outlook is very strong. I am thrilled and delighted to get to share with you some of those details. So going on to slide 2. Will we be projecting slides or? Okay, perfect. So just want to, and am I advancing here or should I indicate advancement? Oh, there we go. Okay, perfect. So overview of the presentation. I'm going to begin by sharing what some of the goals were in these first 100 days before we went through them. Talk through some of the approach of the work that was done. Share with you a CEO board level synthesis of our strengths, weaknesses, opportunities, and threats. Introduce to you a really interesting beginning of a new executive structure, and then land on early wins for trust, what I think may be the most important areas of focus that have come up as I've been listening carefully through this journey. So our goals, number 1, no surprise, trust. That was a singular focus, establish trust, and begin to set the tone of one trunk, many branches. I'll say a word about that in a moment. I wanted to understand, where are we now? Where are we going? And are we ready to go there? And then really identify these early wins, and as I'll emphasize along the way, early wins specifically for trust. And then to come before you and present some of these reflections and see if we are in alignment from the board through the executive, through our executive team, and then if we are aligned, cascading on down through the organization so that we can move as one around what is most important. Next slide. I absolutely love this beautiful heritage oak, treaty oak, and credit our team. As I understand it, this is possibly the treaty oak that was here in Austin, though I haven't been able to 100% verify that is indeed the treaty oak, but it is it? It's beautiful. This one truck, many branches statement I want to share is more than a metaphor. This really is, for me, a daily practice. And at every new employee orientation, at every meeting with every elected official, at every community conversation, we are constantly returning to this understanding that what we are doing is building trust in every direction so that we can create partnerships in every direction so that we can really advance our mission. And perhaps because this heritage oak doesn't just resonate with me, but is deeply part of this beautiful city and community that we have all committed to, I feel this message has been resonating, and this metaphor, I think, is beginning to get out there, and it seems productive. So a little bit about the approach. This slide is intended to, it's not precise, but is approximately correct. Just want to share with you all some of the work that we've been engaged in, and also another chance for me to thank our team. There's, if you start at the top left, 22 topics and 37 hours of briefings. Many times this was our entire executive team, or large subsets of our executive team, having put in many more than 37 hours to prep and condense a great deal of information and context, and then bearing with me through my ceaseless and painful questioning as we often went over the allotted time, but the team made that investment, and I did my utmost to make it worth their while, taking careful notes, reviewing those notes later, and doing my best to absorb and get the full value out of their investment. We covered topics from governance to structure, relationships, strategy, context, and more. Moving over to the right, there was a great deal of effort invested in connecting and listening to stakeholders throughout our environment, a total of 415 people approximately, and this was as of May 15th, so it's even more today, about 380 hours of total time spent meeting and beginning, of course, with all of you. I believe each of us have had meaningful one-on-one time together to get to know each other and connect around our core values and why we do this work and what your advice is, and I'm deeply grateful for the time you've given to me. With our executives, we had 3 conversations, each executive. The first conversation was really a get to know you, no work. Let's just get to know each other deeply. The second was to break bread and share a meal together. Humans, it's different when we break bread together. It advances that trust. And then the third was an in-depth business review, some of which culminates in a CEO SWOT synthesis, which I'll share with you shortly. The leadership teams at CommuniCare and Sendero have been equally generous with their time. I've had time with the boards and with the executive teams. This actually may be an underestimate, but about 20 people, 20 meetings at 42 hours of time. Deeply grateful for the imposition, but I'm grateful for the generosity. A lot of time with our central health staff, whether mingling and visiting through our workplace or in various team meetings. About 295 of our staff. I think it's higher than that now. Elected officials, I actually think the count is a bit low, but again, this is approximate. Health system leaders, community leaders. And then if you think about site visits, we want to actually go and see. So 42 visits in nearly 90 hours to visit our clinical and admin work areas, to attend, I believe at this point, nearly all of our departmental team meetings. And we're going to keep on going and repeat this on a quarterly basis. I'm grateful to teams, particularly Stephanie McDonald, who bore with me through several driving tours to allow me to understand the geography of our environment and see where our patients live, the vast tracts of land where we may grow and the community is going to expand, see our current and future facilities along the I-35 corridor and the Eastern Crescent, and more. We're not done with the driving tours. I believe Manager Jones and I have a date coming up to visit with Commissioner Trevelyan and continue to see and learn. And then a series of community conversations with our API community, with our Black African American community, our Hispanic community, and the roundtable and the community conversation that we all participated in, many of us participated in just yesterday morning. And finally, pulling all this together through our executive team. Thank you, Anne, for making yourself available to help me think through and adjust and align along the way in multiple touch points, and finally to today. So just a little bit of how we got to today's presentation. If there's one thing to take away from these reflections, it is that we have absolutely the best people. Central Health, CommuniCare, Sendero. Our team is passionate about this mission. Everybody cares. We have a capable, experienced team spanning their range from fresh out of training or possibly even volunteering with us as they're coming through their schooling, all the way through folks who are fully pensioned and retired from roles of the city and coming to work every day for years and years and years beyond that because they care. I can't overemphasize what a joy that is for me to be among colleagues and a whole community where we deeply, really care. Even if we see things a little differently, that's an opportunity for learning, for discovering our own blind spots, for getting to better solutions. But I have not once so far, it may come, but in these 100-odd days, I have yet to find somebody I've met with where I couldn't see clearly that they deeply cared and we shared core values. So that is a constant joy. I spring out of bed with gratitude and energy because of that. All right, so this is a SWOT analysis. I want to emphasize that any SWOT analysis is incomplete, and this is a certain slice. every executive, and actually many of our directors and vice presidents, ended up sharing with me their own SWOTs. So we crowdsourced this, and I also, I believe, asked many of you for opportunities and threats. And so this is imperfect, but this is one view, and I was fairly parsimonious in what went on the slides here. But starting up in the top left, that's strengths. Without a doubt, our mission, our culture, our people, the sense of commitment, the boldness. We are government, and it feels like a startup. Our team is growth mindset oriented, flexible, willing to fail and learn fast, to save wisely and then pivot and accelerate the healthcare equity plan to capture new opportunities, partnering with our colleagues in the carceral system or with diversion and so on and so forth. This is an amazing team that is by far and away our greatest strength. I also think we can't overstate the financial strength and flexibility with which we have been invested and empowered by a community that believes that health is a human right and has chosen to impose a tax on themselves to allow us to provide the care for the least among us, and in so doing improve the health of the community. We can do things that we could not do if we had to go out to the private insurance market and work off those schedules, or if we had to document a return on investment financially at exactly 365 days. We don't have to be handicapped by those millstones, which actually weigh around the neck of most health systems around the country. It's an enormous strength. The next bullet point is another enormous strength. We've played with the words here. Actually, the word I like better is community health DNA. I don't need to convince anybody around this table or around our hundreds of team members in Central Health and nearly 2,000 team members throughout our family that the locus of health is in the community, in the patient's context, a home if they have a home, their social connections. This is where we want people to be able to be and reside and return to quickly if we can. And that center of gravity will orient everything that we build. And that is also an enormous strength. That assumption that health resides in the community is not actually the lived assumption in most large health systems because of the way that health systems are paid. And this fourth bullet, the fact that we are now sprinting into the health equity plan. It is no longer a stated need or a theory or a forecast, but as we have all heard, we are now directly delivering care in 11 clinical service lines, several diagnostic service lines, navigation centers, coordination of care, medical respite, and so on. It has profoundly changed the way that we see our work, the way that I am able to talk about our work, the way that our team members are talking about the work to their families and their loved ones. It is much more real and tangible. It is our North Star, and this is not the same organization that it was a year ago. We are not received in that same way. When we sit down at the table with our colleagues, there is an understanding that we are active, direct partners, and it is invigorating and a deep honor and a responsibility that we welcome. Moving over to the weaknesses, I want to caveat the weaknesses box to say that what you see here is sort of day one SWOT. So on day one, some of the greatest opportunity that was lifted up to me was the alignment and trust amongst our family between Central Health, Community Care, and Sendero Health. I'm pleased to report, as I believe you can see in the way that our teams are collaborating actively in these presentations and the warmth in the room, that I am much less concerned about this particular point than perhaps on day one. We are improving and well on our way, and I'm grateful to my colleagues at Community Care and Sendero and to all of you. I think we're making wonderful progress here, and we've got some specificity to come as we get to the early wins. There is still a concern that our growth is outpacing our systems. This is partly a result of our making the strategic decision to rapidly stand up services in the health equity plan. I think that was the correct decision. There's been a lot of desire, I would say, in our community and amongst all of us to get out there and begin to close these gaps. So we extended rapidly, and we now need to do some catching up. There's a sense that everything is on fire, and I'll share even more colorfully. I'll attribute this one to Mike McKinnon. He said, Pat, sometimes it feels like we are trying to grab bricks out of the air and lay down mortar and build a house in the middle of a hurricane. Mike has a way with words. I couldn't forget it. I'll credit this next one to Alan Shalsha. In one of our briefings, he shared with me, you know what we've been really good at, Pat? And I say this tongue-in-cheek, so please understand these remarks are colorful. He said, we were specialized in hunting down squirrels, and when we found the squirrel, we would fund that squirrel, and then we would fund that squirrel's family. And then we would build a nice house for all that squirrel family's nuts. And we would keep on going in this regard. And you have to know Alan to know that his eyes were sparkling as he said this. And of course, the implication is what we need to do is focus. If everything is a priority, then nothing is a priority. As we move forward, we need to begin to really understand that the needs outweigh the resources. We must be intentional. We must be deliberate. So moving down to threats, litigation and politics at the local and state level, I'll actually leave it at that, recognizing that everyone on the table is deeply familiar. There's a great deal in this bullet. And the next is the greatest risk. Should there be significant legislative tax caps, limitation on our ability to fund and pay for the care, that would be very damaging. The needs do outweigh the resources. As much as we have thoughtfully saved and planned ahead, and we have strategic reserves, they could go quite fast if we are not wise about how we commit and how we choose to spend that public resource to great effect. So we're aware of that. And this last bullet has actually resonated quite a lot as I have begun to visit with people. The notion that for perhaps very good reasons, and this is not critique in any way, shape, or fashion, but for a period of time, we have been in a bit of a defensive crouch. We have been on the back foot. And that defensive posture at this moment in time undermines trust. It is our privilege and our requirement to now get out on the front foot and use the fact that we are directly caring for patients. The story of the 86-year-old woman whose severe foot infection we caught and then cured on a Friday afternoon so she didn't lose her foot and didn't lose her life, and many of the stories like that. This is what we need to be doing to be messaging to the heart and to the head in the data and the dollars, and especially in what this means in the access to the care that our community needs and deserves. We need to nurture and earn that public trust even further, tell our story. There is a window of opportunity with a number of new executives in our space in key positions, ranging from the city to the medical school, Integral Care, Sendero Health, ACC, AISD, Chair Kitchen in her role, leading our board, and so on, where there is a moment for us to perhaps come together as a cohort and turn the page and really find a way for us to combine and synergize our collective efforts and do more together, aligned. And that is really the opportunity then to convene and align those key partners together as a key part of the health authority to anchor this space as Harris Health anchors that space in Houston, Parkland Health anchors that space in Dallas. This is our role that we need to earn and deliver and grow into that space. But I think we're already beginning to see the early signs of what that does to the nature of the conversations that we have and how well we can align and aim for shared targets. All of that builds up to the most profound opportunity, which is to build it right. The challenge is not to understand what needs to be done. The challenge, actually, is to recognize that with the strengths in the top left box here, we have the opportunity and we have the responsibility to be bold. I'll give the one example that the board has heard about before. If we had to be paid fee-for-service for the medical respite care that we do, we might have to discharge patients to the street and focus on the next patient and visit with them every day and document that note and bill fee for service for that note. That's not a critique or in any way other than stating a reality for how many medical respites have to run because that's the constraint they live under. Instead, we know that if we don't help people exit the recurring homelessness cycle, then the public will pay for the incarceration in the jail or for the hospitalizations and the cycle from hospital to street to jail to street to hospital to street to an early death. The public pays a much greater cost for that cycle. It is therefore our responsibility to know that and to aim further. So our goal to say we will own the 12-month outcome of stable housing and engagement in care. We won't solve it overnight. The baseline might be 5%, it might be less than 5%. We don't actually have that baseline, but if we go to 10, that means something. Go to 20, that means something. It's a long journey, but we will help people exit that cycle of recurring homelessness, for example, if we can. And that is our opportunity to build it right because we have freedoms that most health systems do not have. So this includes the quadruple aim. That's kind, dignified, compassionate care we'd want for ourselves and our loved ones. That's high quality outcomes, early detection, cure, and prevention of cancer, prevention of amputations, strokes, heart attacks, kidney failure, and early death. It's high value care. What do we get for what we spend? We need to steward these dollars effectively and also recognize that by moving upstream, we may prevent very ineffective, expensive, and unjust care downstream, where folks get stuck in very expensive, high complexity parts of our system if we don't prevent or if we don't connect the dots and allow people to flow from, let's say, the Austin State Hospital into step-down care opportunities and then into community assisted opportunities and permanent supportive housing and so on. There is a continuum of care that underlies the systemic challenges that we are familiar with, and we have the privilege and the responsibility to solve those systemic challenges at a systemic level. So this is our greatest opportunity. We've heard a great deal about this.
Pat, I said earlier I would keep people up to date on our weather.
Please.
So I think if we can finish tonight by 7:30, that should allow people to get home safely. It's different in different parts of the city. So maybe we can wrap you up by about 7:10 or so. Now let me just say that you have done fabulous, amazing work, and we don't want to cut short our opportunity to talk about that with you. So this is a very good first glance for us, and then we're going to ask you to do it again, or at least do a major part of it again, so that we can really talk about it with you.
Okay.
If that's okay. I'm just trying to think. We've got people all over the city, and we've got some concerns. So.
Understood.
Okay. All right. Keep going.
I'll keep us moving. The one thing I'll say here is just imagine every asset in our family all around the city, digitally, and materials in print. I just invite you to share with me a little flutter of joy every time you see our shared art mark, one flag, one family, one mission, for the foreseeable future. All right, I will move through this very quickly in the sake of time. This is more of a sort of internal experiment that we're running in our team, executive team. But briefly, the notion of a dyad. I have a new close colleague who is a Navy SEAL commander and taught me that in the Navy SEALs, they're taught to always have a swim buddy. The idea is you might be in the water with 12 other SEALs, but there's one person in that water, and you know that the two of you are either going to make it back to the boat or shore, or you're going to drown together. And you therefore really learn to lean in. This is about 1 + 1 = 3. So everybody on our executive team now has a swim buddy. And we believe that this may lead to flexibility, synergy, and balance across the team. Very briefly, this is something like an org structure-ish, with the CEO at the bottom supporting all the rest of the branches. On the far left, you see human resources is sort of the first branch, got to have people. Then strategy and finance, where are we going and how do we pay for it? Then healthcare delivery, the kind of main show that we've been talking about. Infrastructure and joint tech. You know, it's not enough to get the planes in the air. We're going to have to get those planes back down on the ground and the patients safely deplaned. Governance, external affairs, critically important. Communications and maybe development in the future in that branch. Compliance and legal, dyaded together. There are times where the risk is not worth taking. There are times where if we just slow it down a little bit, we can dot the I's and cross the T's. In a future environment, we want to be able to withstand audits and so on. Very important. And then I have the great benefit, and with their permission, I will share the special advisors dyad has dubbed themselves the Century Club, because combined, there's more than 100 years of profound experience between Rayette and Juan that they share with me to make sure that my blind spots are less darkened and that my peripheral vision is broader. So I'm deeply grateful for the team. I do want to spend a moment on this slide, and I would invite managers to share input on the slide, and then if it resonates, actually consider finding your own way to narrate this slide. So, and I'll add one more point of gratitude to Diana Berto for putting this together off of just a sketch on my whiteboard. So thank you, Diana. This tree starts with trust. Trust is the gateway to whole person care. Whole person care broadly. I won't belabor it in the sake of time, but you all have heard me talk about this. And not just for one individual, but at scale, which is so much easier said than done, and requires partnerships. And all this adds up to the outcomes that matter, the quadruple I talked about, where the outcomes themselves are the foundation of what we mean when we say health equity. It's the results that matter. The branches that nourish this trunk begin with the financial strength and flexibility that we've talked about, our community health DNA that we've talked about, our family, CUC and Sendero, and how we work together and complement, strategically complement and lift each other up. The North Star of our health equity plan, our partnerships with the county, the city, Integral Care, UT and Del Med School, and our community, our people and culture. We need an environment where people feel the love and kindness and support that we want them to naturally be able to give to our patients and to their partners in front of them. As a human being, it's very hard to give what we don't receive. And so that is our job, to structure or create an environment where our people receive what we want them to give. And then to speak to the heart, as you've heard us working to do. This is human work and it's mission work. And we know that, it's hearts, then heads, then hands, in that order. That's always the way. And we're going to communicate with that understanding, with love and purpose in the patient stories, why our work matters, and that we are strongest and we are one trunk, many branches. So feel free to actually pull this slide out and leave it on the side to reference to, because everything that follows, hopefully you can see, is located on this tree of kind of how we think it works at this point, or how I think it might work based on what I've heard so far. So this next section, and recognizing, Chair Kitchen, that we might not get to all of this, please let us know where the right point is to pause and circle back. But these are the early wins for trust. To my earlier point about squirrel farming, this is the antidote to squirrel farming. And a lot of new executives talk about early wins, but in conversation with Ann, we wanted to focus this on trust. Actually, my very first conversation with Ann, we asked this question: what are the early wins? And we've been in continuous conversation. There's been about 20 really good ideas that we over time narrowed down to about 6 ideas. And to be clear, these are FY24 wins to begin to align these with our fiscal cycle. So some of them are areas that we've been already moving forward with, and work that you've already heard about in our meetings. So the focus today is to see the big picture here, to hear what the target is, to know that we want to know what's important, and let's start with the end in mind. And actually that is those steps come before we then understand all the operating parameters and the obstacles that need to be overcome and how we overcome the obstacles. We have to know where we're going first. So for some of these, we don't have that operating plan completely worked out yet, but we do have the purpose and the value of each of these 6, which is what follows in the slides to come. Just to name the 6, goal number 1 is specialty care, and win number 2 is respite care. These are core elements of our health equity plan. So for these 2 goals, we do know broadly what the next years are supposed to look like. So we actually have both our proposed FY24 targets and an early view draft of the FY25 targets, so you can appreciate what the scope and ramp looks like going into the next year. Those are not finalized yet, but wanted to give you a flavor. There's a bit of a hockey stick or a Nike swoosh moment here as we move from standing up the services to scaling the services. Goal number 3 is around people and culture, vital. I think enough said there. Goal number 4 is really around the alignment of our family, and there's a lot of work that has already been accomplished, some of which is symbolized in the art mark right behind Chair Kitchen today. Goal number 5 around inmate health and jail diversion, critical areas of need within our care continuum, and also vital priorities for our county commissioners and a vital point of alignment. We agree, and we applaud the judge's vision and the commissioner's vision, and we're standing ready to partner also with Integral Care and the county. And the goal number 6, what we've all been engaged in actually, is a very intentional process for understanding what needs to be accomplished, getting ideas from the community, from the managers, from commissioners, from the public, lifting up that voice, vetting the best ideas, this is to come, and then maturing those best ideas into solid budget proposals well in advance of August and September. So by the time we get there, we all know what's coming, what we chose to lift up, what we chose to not put in the hopper this year, so that the ones that we did lift up will have the best chance of truly being successful, and hopefully landing in a place where the vote itself is fairly routine. So those are the 6, and with this, depending on your preference, Chair Kitchen, I was going to begin to invite up our executives to speak to the core slides that they are sponsoring.
I think that well, let's just say this. I think that these early wins for trust, this is our board's first chance to kind of start thinking about these. And these are both amazing and very important for all of us. So we need enough time to talk about them with you all and really tell you how we're thinking. So I am wondering if it was okay, if you would have time for maybe getting through one, and that might be all. So I'm wondering if it's in the backup, and I'm looking to my colleagues also. I don't want to speed us through stuff if people are upset about that. But what I'm thinking we should do is, why don't you take the next 5 minutes or so and say anything else you want to say about these? Then let's make sure we have plenty of time at our next meeting. We could even do it, well, we'll do it at the very next possible opportunity, because I'm sure that everyone around the table here has a lot to say about these and has a lot of questions. So I'm looking around the room and seeing if everybody's okay if we move this fast.
My preference is actually, I think that this is a nice breaking point for us to actually encapsulate this remainder of the presentation. I think should be encapsulated and honored, if that's possible, and if
As
there's
whole.
not time sensibilities around it to do it right now, because I really love the layout of what we have coming up, and I think it deserves
Next time.
thorough discussion.
Okay, so I think what you're hearing is perhaps I can say some excitement about this, some real interest in this, and we don't want to cut it short. So can we do that the very next time?
Of course.
I know you all have put a lot of effort into this, and it shows. A lot of thinking, a lot of exciting thinking, and I'll speak for myself here. I love the tree. You know, I love trees anyway, but I love this. So, you know, we're moving towards something that we can all feel really good and excited about together, and we can all talk about it together. So I think it's okay with everyone if we wrap up here, and everybody okay?
To be continued.
Okay, all right, we'll do that.
Sure, just one second.
Okay?
No, I just want to commend you on your work and efforts. I feel the love that you have put in, and it's from your heart. And thank you so much. It's really appreciated. Thank you all. Just wanted to make sure I just.
Okay.
I also want to echo that. It's felt, it's 100 days, but we feel your presence. And I think we see that synergetic sort of lift with not just you, but also the team, and how you all mutually lift each other up. And I think we feel that too. And I don't underestimate the challenges of change, especially at the executive lead level. I don't think anybody underestimates that organizationally. And for it to still be felt this way, I think is pretty commendable. And secondarily, on that note, and I think an appropriate tangent is y'all's presentation. The executive team, yourself and Chair Kitchen, with the county commissioners, I think all of them showed up, and the judge. And just again, the synergy among all of y'all, including our governing authorities, it was just, it's a sea change. Our community conversation yesterday, we had speakers that were at that conversation yesterday over here today, and I just, and of course the unified branding, I really feel it gelling. I really, really, really do, and thank you so very much. Not to mention, of course, the products that we're being presented with. So thank you.
Okay. All right, I think you're feeling the love, hopefully, from all of us.
I am. Thank you so much.
Okay, I am going, thank you. So I'm going to
Chair
move.
Kitchen,
Oh, yes?
Chair, this is Shannon. I just wanted to echo what everyone said. I'm
Oh,
sorry.
hi, Shannon.
We don't see you.
We don't see you, so we weren't sure where your voice was coming from. Go ahead, Shannon.
Yeah, I just want to echo what was saying. Pat, fantastic job. I'm sorry I had to leave. I have a little emergency plus other issues. So I agree with us having a little more time to vet and discuss as a group. So I just want to say that, let you know.
Okay, thank you, Shannon.
Thank you, Shannon.
Okay, we're going to move on now to executive session for items 5 and 6. Managers, item number 4 relates to the process for performance evaluation. We'll take that up next time after we have more time to talk about with our CEO about his report. So I'm going to read items 5 and 6, and then we'll go into executive session. Item 5, receive and discuss a briefing regarding Birch et al. Versus Travis County Healthcare District, DBA Central Health, and Dr. Patrick Lee. Cause number D, do I have to read all this? So cause number D-1-GN-17-005-824 in the 345th District Court of Travis County. And then item number 6 is receive briefing from staff and legal counsel, consider any settlement offers, and take appropriate action to delegate authority to the president and CEO to negotiate and settle potential litigation claims involving the district. So I announce the board is convening in closed session to discuss items 5 and 6 under Texas Government Code Section 551.071, consultation with attorney. You guys are, okay. Yeah. That was good to hear what it was. Okay, so it is May 22nd, and the time is 7:45, and we are entering open session for the Board of Managers. We are on item number 6, and we need a motion. Okay, we have a motion from Manager Valadez.
I move that the board delegate to the president and CEO the authority to negotiate and settle certain claims within the parameters discussed in closed session.
Second? Second from Manager May. All in favor? Aye. Aye. Okay, that passes. Okay, managers, we are now down to our last item, which is to confirm the next regular scheduled for next Wednesday, June 12th at 4 p.m. or, no, wait. For, not next Wednesday, but for June 12th at 4 p.m. or immediately after the Executive Committee at Central Health Administrative Offices, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment.
I'll move that.
Motion by Manager Valadez, second by Manager Martin. All in favor? Aye. Okay, thanks, everybody, and thanks for your patience. I'm sorry to have rushed us through.
No, that's fine. Yeah, Seymour.